What's going on, everyone? Happy Saturday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive for COVID, flu, or any of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Saturday edition of the Virus Update for Saturday, April 12th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed on what's going on with each and every one of these viruses. While right now we're in a lull for the COVID pandemic, we are in a surge of measles cases. Yes, measles is a problem here in the United States, and many other places around the world are starting to see measles cases. Yes, that's a virus that was once, eradicated. It was listed as under control, but at the moment it is not under control. There's also a lot of other viruses that are bad. Back during the winter, flu went out of control, and there are other places around the world, such as Australia and New Zealand, that are now just getting ready to enter into the fall and winter season. And guess what? Flu there, it's not going well, which means next fall and winter for us here in the United States could be much of the same once again. You need to be informed on all these viruses. That's what I do here on my channel each and every day. Want to be informed of the latest news, data, wastewater. Yes, we can track viruses in wastewater. Subscribe down below. If you like my video, give it a thumbs up to help me out on the algorithm. Of course, leaving a comment down below helps that as well. And of course, share this video with anyone you know. And don't forget to hit that notification bell. Quick reminder, tomorrow is Wastewater Sunday. Let me know, where do you want to see wastewater data for? If I can find something for it, I'll maybe show you something. Let me know down below the states that you want to see tomorrow, or maybe somewhere else around the world. I'll try and find something internationally, but can't always happen. Alrighty, starting off with just a few news stories today. Then we are going to take a look at the symptoms of COVID. It's time that we revisit that. Easter's just about a week away. All that holiday weekend, people are going to be gathering. You need to know the symptoms of COVID because a lot of those symptoms are similar to flu. Then we're going to take a look at some daily data, a couple other things, and then we do have some new numbers in from CJS. Starting off in Canada with measles. And this is coming from Toronto. The Coca-Cola Coliseum concert goers were exposed to measles. Yes, yet again, another public place, whether it's exposure, whether it be a concert, a hospital, an airport, grocery store. We've been seeing a lot of exposures lately. And yet again, here's another one. This one happened on April 1st between 5:30 p.m. and midnight. So for all of my Canadian followers, subscribers, if you know someone who was at that venue in Toronto on April 1st between 5:30 p.m. and midnight, you may want to call them up and say, hey, or send them a text message or email or something that, hey, you may have been exposed to measles by going to that venue during that time. Alrighty, moving on to this. Common respiratory illness may triple death risk in adults within a year, study shows. Yikes. Adults with RSV and ARI, which stands for acute respiratory infection, are likely to be at a 2.7-fold higher risk of death within 1 year, warned a new study. Yikes. If you want to read this full study or full story, you can go check out my X account and over on Blue Sky. I did post this over on those two areas. Also, take a look at this. Health Department reports another flu-related death. This time we are in Jefferson County, Missouri. I had to look up where it was because there's several states with Jefferson County, and this time it is in Missouri. And the total number of deaths there for this season is at 14. Sad that we have to report a death there. Good that we get something out of Jefferson County, or something out of Missouri, I should say, because it's very rare that we ever get any news out of Missouri. I don't know why that is, and data from the CDC there is often sparse as well. It also says so far this season, which ends, respiratory season, which ends May 17th, there have been 4,052 cases reported to the health department, with 94% being type A. The flu season peaked at 733 cases the week of February 2nd. Remember, we had that second rising of flu in the United States. Well, it hit them hard as well. And they have had 14 total deaths this flu season. All right, I gotta show you this. Study shows COVID infected kids, adolescents, more likely to have heart disease. Yikes, yeah? The risk of cardiovascular outcomes following SARS-CoV-2 infection has been reported in adults. A new study warned that children and adolescents are likely to develop multiple cardiac signs and symptoms as well. Yeah, this is not good. I'm going to make sure this gets to the COVID archive over on my site, the COVID study archive. This will probably go in COVID and kids. It's not a good thing whatsoever. All right, just a couple of things from Mike Honey when it comes to COVID variants. And he says here, he just posted this today, so it says up to mid-March, but he posted it today, so we'll go with it. Here's the latest variant picture for New Zealand up to late March, and the DE-FLU-QE variants continue to dominate at around 40 to 60%. The LP.8.1 variant bubbled up to 22% before falling back in more recent samples. It's struggling. I don't understand why in some countries LP.8.1 is just having a rough go of it, going up. Here in the United States, it did not have a rough go. It went up pretty significantly. Now take a look at this. The MC.10.2.1 sublineage of the DE flu QE variants is still quite dominant at 25 to 50%. But again, that LP.8.1 variant is not. But there is also an LP.8.1.1 variant, which has reached a 20% frequency. All right, moving on now from that. Here's Australia real quickly. Again, up to mid-March. XEC continues to dominate, although fairly flat at around 50 to 60% of the cases. The LP.8.1 variant reached 16%, but then slumped to finish around 10%. Yeah, it went back down. So, again, similar thing happening there. Variants do different things sometimes in various different countries. And sometimes that can be a good thing. Let me explain. If we had a variant that, say, popped up, a subvariant or a variant that popped up out of nowhere, and it just took off in the United States, it took off in New Zealand, it took off in Australia, it took off in UK without backing down, that would be pretty significant. Why would that be significant? Because there would be likely a big COVID wave, and it would be a variant that is succeeding very well. LP.8.1 is not succeeding well in some places, and that is kind of a good thing. Though it did succeed well here in the United States, what did it not do? Well, according to CDC data, it did not cause a wave. That's a good thing. And we could argue wastewater scan shows something else, but at the moment, we're not seeing a big wave here in the United States. They are seeing somewhat of a small something in parts of Australia, not so much New Zealand, but that's because, hey, they're starting to enter into the winter months, and they naturally do see an increase in cases there. So, hey, we'll be looking out for that next big variant, but right now, it is not LP.8.1 because it's doing a mixed variety of things. It's succeeding in some areas, not succeeding in other areas. Hope that makes sense to you. And I'm sure there's a lot of variant experts, such as what you see here on X and other places, that could explain that far better than I could, but I think I'm pretty accurate with what I just said. All right, taking a look at this from the CDC. This is the signs and symptoms of COVID. We're just going to quickly go through this. We're not going to read every single one, but you need to know what the symptoms are because some of them can be quite similar to flu, which is why those multi-tests are very good this day and age, especially in the winter months, because, when other viruses are out to play. Or at play, like flu. I mean, we had multiple viruses going at once back during the wintertime. The following list does not include all possible symptoms. Symptoms may change with new COVID-19 variants and can vary depending on vaccination status. Possible symptoms include fever or chills. Hey, that's similar to flu. Cough, similar to flu. Shortness of breath or difficulty breathing, similar to flu, pneumonia, RSV, and several different viruses. Sore throat, some of those other viruses could start with that too. Congestion or runny nose, yep, that's a COVID symptom, and that's a symptom of the common cold, of a lot of different things. New loss of taste or smell, fatigue, flu can do that as well, as can COVID, muscle or body aches, headaches, nauseous or vomiting, diarrhea. CDC will continue to update the list as we learn more about COVID-19. Yeah. They've said that for a long time. Now, there's certain cases where you need to seek emergency health. Maybe your O2 saturation, your ability to breathe gets so bad that you go into respiratory distress. Yeah, then it's a good time to call 911 or get to the emergency department or call a doctor or somebody. Persistent pain or pressure in the chest. Yeah, that's a good time. New confusion, inability to stay awake, and a whole bunch of other things. If you feel like you're going to pass out while you're dealing with COVID and you're breathing so bad, if your condition continues to get worse and you're just not getting better, then you just want to seek a doctor's office, maybe urgent care, or if it's really serious and you're like really short of breath, like you're coughing so bad and you just can't breathe, yeah, get to the hospital immediately. Already, I mean, a lot of that is similar to other viruses, but you know what? With COVID testing, such as this, and I need you, if you're not feeling well over this next week, more important than normal, you need to be using these at-home tests or even get a PCR test if you can. It's not many places that do that anymore, but you need to test if you're not feeling well. Easter's next week. I know not everybody celebrates it, but it could be a cause for some spread, even if it does not cause a wave, which I don't think it will. Even if it does not cause a wave, there's still going to be people that test positive, and the risk of maybe you're asymptomatic and you don't know it. You spread it to grandma or Uncle John or Uncle Paul or Aunt Sue or whoever it is. Yeah, you need to keep these people protected because they could be dealing with another, they could be high risk. Alrighty, taking a look real quickly at this from, this is the international sports thread over on my site, and yeah, the United head coach, this is Premier League Soccer, Manchester United Premier League Soccer head coach, Eddie Howe, had to be hospitalized for an illness. First they said, despite his illness, he's going to be showing up and doing his duty as head coach. Well, now he's not going to be showing up. Yeah, he has been admitted to the hospital. I mean, why people must push themselves through illness is beyond me. I believe the match was supposed to be tomorrow. Yeah, well, guess what? He's not participating in that now. Taking a look at what's going on with the viral activity levels in Canada, and the wastewater level for COVID is low. Flu A is moderate. Flu B is moderate. RSV is also moderate at this time. We'll do a recap of the UK tomorrow. We're not going to do that today. Taking a look at bird migration. Why do we look at this? Well, we look at it because the risk of bird flu spreading is there when it comes to birds migrating. Take a look at this. We go from Texas all the way up into the northern plains, and we do see that there is heavy migration traffic with birds. And anytime we see that, there could be the risk of bird flu spreading. So, yep, we have to keep an eye on this. The Northeast, not a lot today. It's cold in the Northeast. A little bit of migration traffic in the West Coast as well. Taking a look at what is going on with air qualities for today, and we will see here that there are a few areas dealing with some bad air qualities. Yeah, take a look at this. Across portions of the Midwest, a lot of oranges showing up today. That's not good whatsoever. I need to find out why that is, and that actually spreads all the way down into portions of the southeast states as well, and some of the Great Lake areas. Also some problems on the West Coast as well. Taking a look at what's going on with the EMS calls in Pinellas County, Florida. This is over near Clearwater, Tampa Bay area, St. Petersburg. A few sick person calls going on there. In Philadelphia yesterday, there were 807 EMS calls. Earlier this morning, things were really busy here in southeast Pennsylvania. Montgomery County, yeah, take a look at this. They had at or over 20 calls at one point, and Chester County had several sick person calls. Well, let's do a live look in. It shows that things were much better now. We do see strokes showing up at least one time. Let's take a look at Chester County. Oh, yikes. A lot of calls right now ongoing in Chester County, Pennsylvania. We do see strokes showing up, diabetic emergency, unresponsive person, unconscious person, stroke, heart problems, emotional disorder, heart problems, fall, lift assist, overdose, falls, unresponsive person, sick person, EMS, a standby, that's a sporting event. Yeah, a lot of calls going on. That's not a good thing. Let's see what's going on with the hospital situation in Pennsylvania. And we see just a few calls ongoing at this time. And what is this going on down in Delaware County, Pennsylvania? We see STEMI diversion at this time. And it looks like one of the labs is closed at this time there. And not many other issues going on in Pennsylvania. So that's some good news to report. Taking a look at what is going on with New Jersey, and New Jersey is not doing bad at this time. Taking a look at the recent numbers from New York, number of COVID cases reported there was 1,235. That was reported yesterday. In the hospital, New York currently has 736, 70 people in the ICU, and New York City at this time, we'll take a look at that real quickly. New York City at this time does, take a look at this, show hospitalizations not dropping, rapidly dropping at this. Wow, they started the week with 417. Now they're down to 336. 32 people in the ICU. That is some good news. And I'll tell you what, we do have some more good news from CJS. Let's get to that now. I was going to show you the emergency department visits for people diagnosed with COVID. I think we're going to skip that today. We may show it tomorrow. We may not. One of the reasons why is the majority of the areas are dropping at this time, which is some really good news. So moving on to this from CJS, but before that, I got to tell you about this. And I think I said it earlier. I'm going to say it again. If you tested positive for COVID today, you likely will not be better by Easter. You could still be testing positive. Or maybe you test negative on Thursday or Friday. Fine. Hey, I want to raise my hand, say, I had COVID back during the holidays, the winter holidays, Christmas through New Year's. Guess what happened when I had COVID? I did eventually test negative, and I actually still have my little Ziploc bag archived down here with my positive test. Yeah, though I tested negative, a few days later, started not feeling well again. I tested positive again. COVID came back. It wasn't done with me. The virus was still in me, and it caused me to test positive and have symptoms again. You could have, some people call it a rebound case. You could call it what you will. You could test positive again. And you know what? That period where you've tested negative and then you're about to test positive again, that period where you're negative could be during Easter, and you may start to shed symptoms and you may start to shed virus again, not know it, and it could be at Easter, and then the next day, oh, why do I have a headache? Yeah, for me, it was a really bad headache. And then I said, you know what? Let me take one of these guys yet again. Sure enough, rebound case, COVID once again. Yeah. So, please, if you're sick with COVID, you cannot go to the Easter celebrations next weekend. Sorry. All right, some data now from CJS 83172. I'm going to try and go through this as quickly as possible. It's a lot. Florida, this was his Thursday update. 305 new cases and 9 new deaths. New York, Thursday, 1,459 new cases. Puerto Rico, 169. Colorado, weekly. Test case positivity rate was 2.4%. 10 deaths reported this week. Connecticut, weekly. 569 new cases and 2 deaths reported. Indiana, 561 new cases and 9 deaths reported. Kentucky, 553 new positive tests and 14 deaths reported. Massachusetts, 879 new cases and 3 new deaths. Minnesota, 551 new cases and 7 new deaths. North Carolina, 481 reported hospital visits for COVID-like illness. The CDC reported 344 COVID-related hospitalizations. That's a big number still for North Carolina. And they've added another 30 deaths, which is still a big number. New Jersey, 1,375 new cases and 15 deaths reported by the CDC data tracker. New Mexico, 219 new cases and 7 deaths reported. All right, let's pause for a second. We have forgot to do this for the last couple of updates. We're definitely doing it today because we got a lot more to read. It's time for the hydration break. So if you haven't had a drink of water in a while, pause now. Go get a drink of water. Pause my video. Pause it. You can come right back and hit play after you get a drink of water. Alrighty, let's continue. Doesn't that feel much better? Moving on now to Florida on Friday. 275 new cases and 11 new deaths reported yesterday. 2 are from July of 2024. It never ceases to amaze me how deaths can be found from the previous years. It just goes to show that, don't count that as COVID. Don't, and then they're like, well, maybe that was COVID. Or maybe they hold them back and we get a big death dump. Yep, we've seen a few of them over the past few weeks. 1,981 cases and 46 deaths were reported over the past 7 days. The CDC also reported 361 hospitalizations in Florida. New York, 1,300 new cases, and for the week they had 7,819 reported over the past 7 days, to go with 696 CDC reported hospitalizations and 35 new deaths. Puerto Rico, 151 new cases reported yesterday, and 989 cases and 3 deaths were reported over the past 7 days. All of Puerto Rico's COVID deaths that were reported over this past week were reported on Monday, and might I add, it is good to see that we're not seeing a huge number of cases in Puerto Rico at this time of year compared to other years. But I should mention, at-home testing, it's a thing. It does suppress things big time. Hey, does anyone know if Puerto Rico has wastewater data? If you know, let me know down below. That would be neat to see if there's any COVID wastewater data there. All right, all other figures are weekly tallies. Alabama, 139 CDC reported hospitalizations and 7 deaths reported. Arizona, 740 new cases reported on Wednesday and 9 deaths reported by the CDC. California, 2,192 new positive tests and 499 CDC reported hospitalizations, 25 new deaths to go along with 42 new flu deaths. Yeah, flu deaths are still high in California, and there's, that's what, 3 states now where we've talked about really high COVID hospitalizations, and we're not done yet. There'll be more. Georgia, 197 CDC reported hospitalizations and 22 deaths. Idaho, 453 emergency department visits for COVID-like illness and 4 deaths. Illinois, 274 CDC reported hospitalizations, 13 deaths. Iowa, 5 deaths reported. Louisiana, 757 emergency department visits. That's a lot. That's just bad. For COVID-like illness, a 4.6% test case positivity rate, unchanged from last week, and 6 new deaths. Mississippi, this is really the only time we talk about Mississippi other than Walgreens. 8 deaths reported by the CDC data tracker. I'm going to make a note to myself. We're going to go to the CDC wastewater pages tomorrow for Mississippi. Missouri, 114 CDC reported hospitalizations, along with 86 from the prior 2 weeks that hadn't been reported. Okay. 8 deaths reported this week. Ohio, 240 CDC reported hospitalizations and 8 deaths. Reminder, Ohio is changing their dashboard. It's going to be one of those all-in-ones, COVID, flu, everything else. So I don't know when that's coming out. Oklahoma, 8.2% test case positivity rate, down from 8.9% last week. That's a good thing. 11 deaths reported to the CDC. Pennsylvania, my state, 426 CDC reported hospitalizations and 19 deaths. South Carolina, 143 CDC reported hospitalizations and 11 deaths reported. Tennessee, 139 CDC reported hospitalizations and 17 deaths reported. Texas, 1,655 new cases and 433 CDC reported hospitalizations. I think we're going to mention that in today's title, because there's a lot of hospitalizations here. And 26 deaths reported by the CDC data tracker. West Virginia, 334 new positive tests, a test case positivity rate of 4.98%, slightly up from 4.84% last week, and 3 deaths reported. Wisconsin reports, I need to zoom this out, Wisconsin reports 314 new positive tests, a test case positivity rate of 3.7%, down from 4% last week, and 5 deaths reported by the CDC data tracker. Already, the CDC added 469 deaths since last week. Hey, that is below 500. That is a fantastic number. Remember, just back on Monday, I believe it was, we mentioned, we put in the title, the U.S. is still having over 500 deaths a week. Well, guess what? Finally, for a week, that is not the case. Currently, the total in the United States, the grand total for the pandemic from this count is 1,256,794 226,126 total U.S. COVID deaths. And yes, that could be an undercount, could be a significant undercount, because we're finding a lot of things that weren't counted as COVID, and some of them are getting included here and there, and you know what? That number could definitely be higher. Alrighty, folks, that does it for the Saturday edition of the Virus Update. We'll have another update again tomorrow, where we will have wastewater data. Leave in the comments down below where you want to see wastewater data for. I will be looking at the comments. I'll be responding to comments. And for anywhere I can find wastewater data for, I will add that. Alright, folks, share this video with anyone you know. Give it a thumbs up if you like it. Subscribe if you're new down below. Of course, leave your comments down below. Hit that notification bell. Follow me on social media. And yes, follow me on my new Data Report Facebook page. Alrighty? I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Saturday afternoon. And thanks for watching.